They called him the best surgeon in the country. Dr. Michael Chen could do what others only dreamed of. A heart on the edge of failure? 30 minutes. A valve replacement that should take 4 hours? He did it in 2. Lives saved? Countless. Ego? Immeasurable. Michael didn't just know he was the best, he made sure everyone else knew it too. In the operating room, nurses trembled when he spoke. Junior doctors avoided his gaze. Mistakes weren't tolerated. Questions weren't welcome. He was a machine of precision, and machines don't have patience for human error. Faster, he'd snap during surgery, not looking up from his work. I didn't spend 12 years perfecting my craft to wait for incompetence. His hands were legendary, steady, precise, worth millions. They'd been on the cover of medical journal. They'd saved senators, celebrities, CEOs. Those hands were his identity, his worth, his proof that he was better than everyone else. And then, one rainy November night, everything changed. Michael was driving home from a conference where he'd just given a keynote speech about surgical excellence. His phone rang. Another surgeon asking for advice on a complex case. "You're doing it wrong," he said, barely paying attention to the road. "The approach is all wrong. You need to—" He never finished the sentence. The truck came from nowhere. Metal screaming, glass shattering, the world spinning into darkness. When Michael woke up 3 days later, the first thing he saw was his hands, or what was left of them. Bandaged, crushed, destroyed. The orthopedic surgeon, a colleague he'd once called adequate at best, stood by his bed, face grave. "Michael, I'm sorry. We did everything we could. The damage was catastrophic. Multiple fractures, severed nerves, torn tendons. You'll regain some function eventually, but—" The pause was unbearable. "You'll never operate again." 6 words. 6 words that erased everything he was. The best surgeon in the country couldn't hold a fork. The man whose hands saved hundreds couldn't button his own shirt. The genius who commanded operating rooms couldn't even sign his own name. Michael's world didn't just crumble, it evaporated. Physical therapy was torture, not because of the pain, though there was plenty of that, but because of the humiliation. Exercises designed for children, simple tasks he'd done thoughtlessly for 40 years, now impossible. Trembling attempts to pick up a pen, dropping cups, needing help to eat. And the visitors? God, the visitors. Colleagues came with their carefully crafted sympathy, but he could see it in their eyes. Relief. The great Michael Chen brought down. Some part of them was glad. "You'll find something else," they'd say, voices dripping with pity that made his stomach turn. "Consulting maybe, teaching. There's life after surgery." But Michael didn't want life after surgery. Surgery was his life. Without it, he was nothing. 6 months later, Michael sat in his empty penthouse, staring at his useless hands. He'd lost everything: his career, his identity, his purpose. Most of his friends had stopped calling. The hospital had retired him with a generous package and a gold watch he couldn't even clasp on his own wrist. He was 45 years old and his life was over. That's when he got the call. "Dr. Chen, this is Anna from the hospital's volunteer coordinator. I'm not interested in—" "Please, just listen. We have a program in the psychiatric ward. Patients who are struggling. Some are suicidal. They just need someone to talk to, someone who understands what it's like to lose everything." Michael almost hung up. Talk to people? He was a surgeon, not a therapist. He fixed bodies, not minds. But then Anna said something that stopped him. "These people are dying, Dr. Chen, not from disease, from hopelessness. And right now, you're the only person I know who truly understands what that feels like." He showed up the next day, mostly because he had nothing else to do. The psychiatric ward was in the basement of the hospital where he'd once ruled the top floors. The irony wasn't lost on him. Anna led him to a quiet room where a woman sat, staring at nothing. "This is Margaret. She tried to end her life 2 weeks ago. She hasn't spoken to anyone since. But maybe she'll talk to you." Michael sat down, awkward, unsure. What was he supposed to say? He wasn't trained for this. For 5 minutes, silence. Then, quietly, he spoke. "I used to be somebody." Margaret's eyes flickered toward him. "I was the best at what I did. Everyone knew my name. I saved lives every single day." And then, he held up his scarred, trembling hands. "Then I lost the only thing that made me matter." More silence. Then Margaret spoke, a voice barely a whisper. "What did you do?" Nothing. I'm doing nothing. I'm nobody now." "No," she said, looking at him for the first time. "You're here. That's not nothing." Something cracked in Michael's chest. Over the next weeks, Michael kept coming back. Not because he had to, because something in those conversations, those quiet moments with people the important doctors didn't have time for, felt like it mattered. Margaret started talking about her daughter, who she hadn't seen in 3 years. James, a veteran who'd lost his purpose after leaving the military, started making plans for the future. David, who'd tried to die because he felt invisible, started to laugh again. Michael wasn't fixing them, he couldn't, but he was sitting with them in their darkness, and somehow that was enough. One day, Anna found him in the hallway, exhausted but different. "You know what's remarkable?" she said. "In 6 months here, you've helped more people than most therapists do in years." Michael shook his head. "I'm not doing anything, I'm just talking." "No," Anna said gently, "you're listening. You're being present. You're showing them they're not alone. That's not just anything, Michael. That's everything." That night, Michael sat in his apartment and cried for the first time since the accident. Not because he'd lost his hands, because he'd found something he didn't know he was missing. In the operating room, he'd saved lives by being the best. In that quiet room, he was saving lives by being broken enough to understand. His hands couldn't hold a scalpel anymore, but they could hold someone's hand when they needed to know they weren't alone. His brilliant mind couldn't plan complex surgeries anymore, but it could listen, really listen, to someone's pain without trying to fix it. His identity as the best was gone, but maybe, just maybe, that had been the problem all along. A year after the accident, the hospital hired Michael as the lead peer support counselor for the psychiatric ward. Not because of his medical degree, not because of his former brilliance, because broken people trusted someone who'd been broken too. He never operated again, but in his first year in that basement ward, he helped prevent 14 suicides. 14 people who'd given up on living found a reason to try again, because someone sat with them, listened to them, and showed them that losing everything doesn't mean you've lost your worth. The surgeon who once saved lives with precision and skill learned that sometimes the most powerful healing doesn't come from what you can do with your hands. It comes from showing up with an open heart and saying, "I see you, I hear you, your pain matters, you matter." Humility isn't thinking less of yourself, it's thinking of yourself less. It's not about being weak or worthless. It's about recognizing that your value doesn't come from being better than others. It comes from how you show up for others. Michael learned that the hard way. He'd spent 20 years being the best, and in losing everything that made him the best, he finally became someone worth being. Someone who saves lives not by being superior, but by being present. Not by having the steadiest hands, but by having the humblest heart. So, if you're watching this and you feel like you're nothing without your achievements, your skills, your identity, Remember Dr. Michael Chen, the surgeon who lost his hands and found his humanity. The man who discovered that true healing doesn't require perfection, it requires presence. If this story touched you, subscribe for more tales that transform perspectives. And in the comments, tell me, what would you be without the thing that defines you? Because maybe, just maybe, that's when you discover who you really are.